Thank you very much, respected chairs and my colleagues, friends. Uh, I'll be presenting to you the burden of hepatitis C in Pakistan, what we have achieved currently, and what we have to really achieve to go for the hepatitis elimination. I have no conflict of interest. The slides that I'll be presenting to you, the talk would cover the current situation of hepatitis in the country, what are the goals and what successes we have achieved so far, and then I'll touch upon the Prime Minister's program for the hepatitis C elimination. You have already seen this slide, and this slide is obviously not a good one in the sense that it tells us that Pakistan now has the largest burden of hepatitis C in the world, and currently our hepatitis prevalence for hepatitis C is 7.5%. The disease is all over the in all provinces all over Pakistan. So we see that we have got the largest disease burden in Punjab, which is of almost about 6%, 6 million, and then we have Sindh with about 2 million people, and a total we have about almost 10 million people who have the virus in us. So this 10 million are the people who are viremic. So the largest burden is in Punjab, followed by Sindh, and then there is other provinces which have a relatively smaller burden of Hep C. As per WHO, the elimination strategy should encompass reduction in the hepatitis C new infections by 90% and a mortality by 65%, and we should be able to diagnose 90% of all infections and treat 80% of those who have been diagnosed. So this you all know. So far what we have achieved that, we have got about 10 million viremic people, and of these 10 million, we have so far been able to only diagnose 30%, and that there's a gap of almost about 60% who have not yet been diagnosed, and then only 15% or 16% have been put to treatment. But the good thing, as you already heard, is that once we put them to treatment, almost all of them, 97% of them, get cured. But this huge number of people who have not been diagnosed so far is the real problem with us. Because these undiagnosed and untreated patients will result, as you heard Graham Foster say, that we are now also facing a liver cancer epidemic. And every 20 minutes, a Pakistani dies of hepatitis C related complications, which could be a liver cancer or a liver cirrhosis. So we are adding almost 0.4 million people. We already have a pool of about 10 million people. And then we are treating only 0.2 million people, and about 1.16 die because of the liver related issues. So by and large, the number of infected people is increasing over time because there are more infections which are adding, and then those who have been cured or who have died because of the chronic infections. So I think with this pace, it appears that it might be very difficult for us to achieve the hepatitis elimination, because things have to be tightened, as Graham was saying, that we have to really tighten these things and control the risk factors. And again, something to really ponder on is that we to detect one HCV positive patient, we need to screen at least 12 people. So for screening the whole population, we need to screen almost about 14 million people every year to screen the whole population and find out these 10 million people who are infected. So this was the scenario, but like we were not sitting idle. The gastroenterologist and the hepatologist and the people who were worried and looking after this situation, we were not sitting idle, and we have been working. And this is what I'm trying to show you here. That in 2008 we did the first national hepatitis sero survey, and then following this in 2012 we had the technical advisory group on hepatitis which was established. Then we had the patients group which was established. And then the CSOs, or the civil society organizations, also joined the hepatitis program. In 2014, the branded Gilead Sofosbuvir was introduced in Pakistan. Then in 2016, we started producing our own generic DAs. And then in 2017, Pakistan developed the National Hepatitis Strategic Framework and the Provincial Action Plans. And these were the two actions that we were the first country in the AMRO region to develop these things. So this was like we were really working very fast. In 2018, we developed the National Hepatitis C Testing and Treatment Guidelines, which were again revised in 2021. And then in this era, we also did the Punjab and Sindh did their new sero surveys. In 2021-22, we developed the hepatitis B treatment guidelines. We developed the prevention of mother-to-child transmission of Hep B guidelines. And the CDA, or the Center of Disease Analysis, also undertook the evaluations and the mathematical calculations for Hep B and C for Pakistan. And then very recently in August, the Prime Minister's program for the elimination of hepatitis C has been announced. So this is all the progress that we have made over these years while we were all working together to eliminate the disease. The CDA has done this mathematical analysis, and they informed us that Pakistan needs to put in a lot of money to eliminate hepatitis C. And initially it would take all the money would go for the testing and treatments. And then once the disease is treated, then these numbers go down and all the expenditures will gradually go down. So this is the Prime Minister's program for the hepatitis C elimination in Pakistan. The total cost of this PC1 the project proposal was about 70 billion, and out of these the Prime Minister approved 35 billion, which is 50% of the total cost. And just to reinforce that this is not a vertical program, it is an add-on program to the already existing provincial programs. This is to support the already running provincial programs. The federal government shall procure the commodities, which would comprise of the rapid tests, the PCRs, and the medicines, and these would be supplied to the provinces on their need basis and as per their performance. The provinces are encouraged to enhance their own funding to match the federal grant, but this grant would not go to the federal government. This would remain with the provinces, and provinces would just use it in their own districts and areas, but they have to show that they are enhancing their funding to match the grant. Then, as you all heard, that almost about 60% of the healthcare seeking behavior goes to the private sector. So we think that the private sector can also play a major role here, and they could contribute by catching up by seeing these patients and managing them and treating them, and this could contribute and bring us to the 100% that we were really looking for. 50% coming from the federal, and then 50% coming from the provinces plus the private sector. And then obviously the financing from external resources. Again, you all heard Graham Foster say very well that we have got friends outside Pakistan who are really eager to help. So these are all funders and supporters who can help us. So while the program is still has been announced but has not yet been launched, we are again, all of us are really working very hard as how we will unfold this program. So what we have worked on, and we have kind of come to the consensus, is that we will have an electronic medical record data set for the whole country, because without this we would not be able to really catch what we want to. And then this would be linked to the NADRA and the National Identity Card, custodian, to ensure that there's a full coverage and there's to avoid duplication. The screening shall be done at the grassroots level, which would be either a rural health center or a Tehsil headquarter hospital. And currently we are doing the capacity assessment of these sites in all provinces and regions. And then again, public-private partnership is being encouraged, and this would be done with the labs, hospitals, and doctors, so that we all work together. We have agreed that there would be a reflex blood testing where anybody who is found positive will undergo a phlebotomy, and the venous blood would be then taken. So it's kind of a decentralization, which WHO very strongly recommends, that the system should be decentralized, and then the blood would be transported to the PCR labs. The capacity building, the capacity assessment of these PCR labs is being currently done to find out what is the daily output of the PCR per province. And let me tell you that, currently we have got very adequate PCR capacity both in Sindh and Punjab. Sindh can do almost about 3,000 PCRs every day, and Punjab and Sindh can do almost about 7,000 PCRs every day. We might be using the gene expert machines at some sites because of the accessibility issues. We shall use the APRI score to decide the duration of the treatment. So again, it's a task shifting, that we would not need the gastroenterologist to really identify the duration of treatment. It would be done electronically. And then medicines should be supplied by the primary care physician, which could be a general physician or a nurse or a healthcare provider. But so it's a complete task shifting and decentralization, so that there's an easy access to the healthcare by everybody. So, ladies and gentlemen, Pakistan has the highest hepatitis C infected population in the world, which is about almost 10 million people. And we add about almost 4 million every year, but we are unfortunately not able to reach everybody, and to date we are only treating about 50%. But let me tell you a very good story here, that in Sindh I was evaluating the systems, and in the last 11 years they screened about 1.2 million people. But in the last 11 months they screened 1.8 million. So in 11 months, they screened 1.8 million, while in the last 11 years, they screened 1.2 million. So, the capacity is really gone up. And so is the case probably in Punjab. So, these two provinces have the largest burden, and they're really, really very, they're ready to really go and enhance and attack on the. So in fact, in Sindh, there are a lot of people who are really waiting for the PCR so that they can start getting treatment. So private sector engagement is very, very important, and it will make a difference. And together, ladies and gentlemen, as you all know, we can eliminate hepatitis C, because it's one liver, and if that liver fails, then the person dies. So it's one liver, one life. So we have to really work hard and move forward. And hopefully, inshallah, we'll be able to eliminate the disease in the next few years. Thank you very much.